Tuberculosis is an infection caused by a bacteria called Mycobacterium tuberculosis. It's just one bacteria which is in a family of many other bacteria. You can say its relatives include other bacteria called Mycobacterium avium, amongst others. So 85% of the cases of Mycobacterium or TB present as an infection of the pulmonary system. But it's not limited to the pulmonary system. It can, in fact, it's said to infect all tissues except the hair and the nails. So most of the time a patient who is suspected to have TB will present with a history of a cough. So if someone comes with a history of a cough that has lasted for more than 2 weeks, a cough that has not responded to different kinds of antibiotic, and has associated hotness of the body with weight loss and night sweats, such history is very sensitive for tuberculosis. When you hear someone saying that, you immediately start thinking about TB. These are for general population people. People who have immunosuppressive states, like people who are HIV infected, they don't present typically like the rest of the people. They may just come with a slight cough. It may not be for a long time, it may be for 3 days, but the fact that they're immunosuppressed points us towards TB more often than for the other population. On the physical exam, we may find the history of fever, or we may have lymph nodes which are swollen, called lymphadenopathy. They may have signs of wasting, find that their body mass index is low and such things. And when you examine the respiratory system, if they have a respiratory infection, they may have those signs of fluid in the lungs. There's a specific sound you hear when you examine, or air is not entering well. You have difficulty in breathing. For other systems, because you said it infects many other systems, not just the respiratory, it may go to the brain, it may go to the heart, it may infect the gastrointestinal system, it may infect the bones. So depending on how they present, you examine them as such, focusing on those areas. TB is infectious. How it's transmitted is through respiratory droplets. The person who has an active infection releases them into the air, then the individuals who are around them, they breathe it in and they acquire the infection that way. So we isolate them so that they can prevent the infection. For treatment of tuberculosis is antibiotics which target the bacteria. These include 4 antibiotics. It's usually a tab which has 4 of them. And for pulmonary TB, you take it, the four tabs, for the 4 drugs, you take it for 2 months, then another 4 months of 2 drugs. If you have a relative who has been diagnosed with TB and you've been in contact with them, you yourself you need to go and get tested. Everyone who has been around them needs to go and get tested. Then while he is on, the best way to make sure that he doesn't spread it is to help them comply to the medication. It's a long prescription, up to 6 or 12 months. People say from the moment you get the infection to when it manifests, it can be 2 to 7 months. That depends on your immune status. Someone who is immunocompromised can develop it sooner, the symptoms that is,